So now we're going to have a session on the importance of hearing children and young people's voices. I'm really looking forward to this. We have Lisa Smith, who's LIAISE Family Support Team Manager at Bristol Royal Hospital for Children, whooping it up for Bristol Royal Hospital for Children. And we've got Vanessa, you're there as well, Vanessa, consultant clinical psychologist with, is that a pony behind you or a donkey?
Yes, I'm partly in Bristol Children's Hospital. I'm partly in a hospice. So we have a few teddies joining us this afternoon, if that's okay.
Well, there we go. May I hand over to you two, please?
Thank you, John. So we're delighted to be able to present to you all today and hope we've got some interesting things to share with you. The rest of the conference has been really inspirational and I've taken away so much already. Just a little bit more about who we are. So Bristol Royal Hospital for Children is part of a wider trust, University Hospitals Bristol and Western, which also covers adult services. We have, as the name suggests, services down at Western, so a huge footprint. So an awful lot of activity going on. We as a hospital are a specialist tertiary provider for the Southwest. So we're providing lots of specialist services for young people right down in Cornwall or over in Wales, and also some national services as well. So we have a really complex mix of children and young people, both at local, regional and national level. We're speaking to you today as the leads for child and family support services within the hospital, and our focus is very much on learning and supporting our young people. I'd like to introduce on the next slide, though, the people who've really done the work around this presentation. Next slide, please, Jade. And here we have Kat and Sarah, who together drive the majority of our young people's engagement work. And in the middle, you'll see Aisha and Ramani, who are two of our young people who have helped us develop what we're going to say to you today. We also then have underneath, we could not do this work without our charities. There is almost no funding for the provision of engagement and involvement activity outside of clinical pathways. So everything we do is funded by our fabulous charity, the Grand Appeal. Now, talking to these guys before we pulled this presentation together, their message was very much, don't talk about what we do today, but talk about how we got there, because actually that's the most interesting thing. And to see that pathway develop for them has been fascinating. Next slide. So this slide takes us back, the next one, to 2008, when University Hospitals Bristol, as it then was, became a foundation trust. And we wanted to have young members. We thought we were very forward thinking at that point. And we were inviting 10 plus young people in our local community or who had been patients within the last 3 years to come and join us. We wanted a function to support them. And so we wanted to look at what that might be, led by our brilliant young persons involvement worker at the time, Kathy Gain. We held an engagement event, and what young people told us was they'd be quite happy with something like a youth forum. They were used to them in schools. It was the kind of thing that they were already doing. And we were delighted to hear that, because that's kind of what the Trust Board had told us they wanted too. So we started to pull that together. We initially looked at these sort of bi-monthly face-to-face meetings, targeting half-term and holidays when young peoples were free, looking at activities that were both going to inspire our young people and help them understand hospital environment and the processes that they were going through, but would also encourage them to speak up and tell us more about their activities. That was then running alongside regular engagement and involvement activities. And you can see there, that's from one of our transition events with the Transition Fairy. They weren't always particularly serious events, but what they did do was allow us to speak to young people in a really relaxed environment about their experience of care and what mattered to them. Our evaluation was good, young people were happy, we had great recruitment, but we learned from our young people that they could really do a lot more. Next slide, please. And what they told us they wanted to do was have more involvement. Now they understood how health worked, they understood things much more effectively. They wanted to really get in and get involved. We were also having increasing requests from services about getting young people involved. And we saw our first young leaders coming forward. a young patient who wanted to write and share the views that the youth involvement were telling us, which turned into a newsletter, Lucy's News Patient Views. We also at this point started looking at young governors as well to sit alongside our board of governors in a very adult trust-based setting to share young people's views right at that top strategic level. So we made some changes. We changed the name of the group. Youth forums were a bit old hat by then. So this is 2013. We're going for our young person's involvement group. So it does what it says on the tin. It's about involvement. Under the review of our new young person's involvement worker, Sarah Reynolds, who you saw on our first slide, we spoke to young people again about what they wanted. We moved meetings to monthly because actually they wanted to meet together more often, and they were quite happy to do those on weekdays after school during term time, so we could still keep the face-to-face activities in holidays. There was an increased focus on learning opportunities. Lots of our young people were thinking about careers in health, so Sim Centre, Q&As with staff gave them a much wider perspective about what they might want to do. And we also started hearing from young people about topics that they wanted to talk about that were hugely important. Probably 2014, I think, was our first young person's takeover on mental health, very pertinent to the conversations that we've had today, with young people talking about what mattered to them, what help they needed, what gave them good support and was useful, but also sustainability and, of course, transition, which I think everybody talks about and is still a hard nut to crack. Increasing our visibility made a huge difference, and interviewing the chief executive certainly got them to recognition at trust level, which was great. So then along came COVID, and everything was going so well. And we thought, what do we do now? Face-to-face activity stopped overnight, and the directive was all non-essential activity should stop in order to focus on immediate patient care. So we had to challenge ourselves and think, is this non-essential? And we spoke to our young people about it to say, do you think this is non-essential? And the overriding view was, no, it's really important for the following reasons. Next slide, please. Our members wanted to be able to meet digitally. They didn't see why they couldn't do that. That wasn't a problem for them. And it was important for them to keep communication flowing. They needed to know that the NHS was still there with all the messaging that was coming out and about, that we were still working for them, that we still had their interests at heart. It actually gave some young people more time. So there were increased opportunities for them to feel part of the hospital community, to do work that they hadn't been able to do before. But more importantly, it was a space to be with other young people with similar interests and experiences, which with the isolation of lockdown and the risks that young people were facing, that to our young people felt a really, really important thing to retain. So we managed to get online, and we were delighted as a result to win a Penner Award for that transformation. It wasn't easy. I'm sure you can imagine the risk assessments, the safeguarding protocols, the GDPR requirements that we had, despite the fact that they could all happily talk to their consultant in a clinical consultation overnight. But we got there, and we were delighted to share that and be successful in Penner regarding communicating effectively with children and young people. But we felt there was still more that we could do. It gave us an insight into what I guess what our peers were doing, and that we shared with our senior leaders who were really interested in the work that was happening. And that allowed us to move to our next level. There was genuine enthusiasm to put our young people really right at the heart of our services and to hear directly from them. I think maybe in the past there had been a sense of not knowing how that could be achieved, but with virtual opportunities, suddenly some of those barriers had gone. And a real opportunity to encourage young people to support other young people, to share their voices and be heard. So we spoke again, where do we take this work? How can we move it forward? And Vanessa first of all, Aisha is going to tell you a little bit about the model that we have now. If we could have the video, please, Jade.
Our trust has an amazing youth involvement group consisting of young people aged between 11 to 21 who all have a passion for improving healthcare service design, delivery and improvement. Our youth involvement group has been involved in a variety of things, ranging from accreditations to doing the 15 Steps Challenge and also having a say in our trust sustainability plans. Not only does our trust have an amazing youth involvement group, but it also has lots of amazing youth ambassadors. So our youth ambassadors attend the children's leadership meetings, and they also attend the Women's and Children's Divisional Board. So I, for example, attend the children's leadership meetings, which are attended by lots of different clinicians who all have a passion for children and young people's health and social care. So in our children's leadership meetings, we talk about a variety of things which are so pertinent to children and young people. And through attending that, I get to voice the concerns and priorities from the youth involvement group and ensure that the youth involvement group are feeding into the work that the children's leadership team are doing.
Can we have the next slide, Jade? So you've heard from Aisha, and I can see in a couple of the comments that some of you have met Aisha, and she's been incredibly wonderful in helping us shape some of the things that we do. So in our next couple of slides, I'm going to give you a few illustrations of kind of where that's made a real impact. And one of the things that we at the Trust have just appreciated massively, and has only happened over the last couple of years, is having our youth ambassadors in our divisional board meetings and our leadership meetings. And we recruit our ambassadors from our youth involvement group, so we have a process so we can have a think about the right support for them. We also have staff mentors to support them. So we spent a long time thinking about how to set this up with our mentors and our young people. When we surveyed this last year, what we found was an immense amount of feedback from particularly our mentors, feeling that they were learning so much from young people. They were learning how to incorporate young people in meetings. They were learning about different ways young people want to integrate and think and be part of our support systems. But probably what was most striking was the feedback from the board and the leadership members themselves, who said they felt truly accountable. And what quite often happened, which is what I'm going to come up onto now, is that young people will come up with some real challenges, which would sometimes mean silence in our meetings, because there was such pertinent points of things that we've not thought about yet and needed to. So one of the things that the board has asked for more this year is for young people to have specific sections where they're just coming and giving their agenda of what do we need to be looking at more. So the first picture you see here about appointments, that came very much from an any other business item, where one of our young people said, I'm not sure we're doing enough to help young people find their voice in their clinical appointments. And we couldn't answer that question, obviously, in the meeting, but we've thought a lot about it, and we've done a lot of looking at what's happening nationally. And one of the things Lisa and I thought quite a lot about is there's a really big ask for young people in their clinical appointments, because they may never have met their clinician before. They might have a huge range of skills and confidence in saying the things that they want to talk about. And our clinicians themselves might have a completely different range of skills and competence in talking to young people. And definitely our paediatric colleagues get very scared about any topics about pregnancy and sexual health when they've known children for a long time. So one of the things Lisa and I thought a little bit about was it's almost a little bit like clinical speed dating, where we're kind of asking these two factors to come together and somehow in a really short space of time have the conversation that they need to have. So our young people have written a guide, which you can see on the left, and all the yellow boxes in the corner, you may have come across these before because they've been around for a while, but these are options grids where young people and clinicians identify the key topics that they might want to talk about. And what both people do is at the beginning of the consultation, just identify the 3 that they want to think about in that appointment. And it really helps both the clinician and the young person focus either on those key areas or know that those are areas that we need to find resources around, or we need to find somebody else who can come and answer that question. So we're piloting that this summer. So we'll have a look and see how that goes. And the other part that Lisa has alluded to, and I know is a really big topic nationally, is transition. And we're certainly not the first trust to be looking at transition guides. There's a lot of them around. But one of the illustrations of where this is, our youth involvement group have been so wonderful, is we have a clinician's guide, because our clinicians are saying, we don't know how to do this. We don't know what we need to say. Can you help? And we have a parent's guide and a young person's guide. And one of the challenges, interesting enough, we had really early on with the Parents Guide is parents saying, we feel really uncomfortable. We're not sure about you encouraging our young people to be spending time on their own in clinical appointments because we're worried they won't ask the questions. And how do we do that? So we can then take that back to our youth involvement group and say, okay, how do we have those conversations where parents feel comfortable about this, but also we're all feeling comfortable that the young person is able to ask the questions, get the information that they need to out of that. So these are some of the things that we're looking at the moment. Next slide, please. And I'm not going to go through this slide, you'll have it to have a look at, but this is where we started last year. So we highlighted with the Youth Involvement Group, what are the things that we should be looking at more? And you'll see from where we started, some of these things have morphed into some of the projects that we just talked about. But there are also things that we don't know the answer to. For example, writing to young people. So we know that this is a really big thing for all NHSs to be thinking about, and there aren't simple answers to this, but we can be keeping that really live, scoping throughout the country what other people are doing. And certainly we do use our other, we do look out to all of our other services, because I think we're all looking at all of these issues and there's some amazing innovations out there. So we're very lucky in that all of our colleagues are really generous in sharing ideas. So we can take some of those forward. Yeah. So where do we want to go next? So our challenge this year from our board is, are we really being diverse enough in including as many young people as possible in shaping our services? So we've just written our 12-month plan to include diversity and accessibility. We're also thinking about, particularly IHSCM that we don't talked about, you know, some of our young people are amazing, but are also growing up. So we're worried about how we maybe support younger people to come up and take on those roles. So we're wondering about alumni groups and mentoring programs. So we haven't got the answer to that yet, but we're aware it's really important. And we're thinking about you know, co-creation always, but obviously that takes a number of forms and is sometimes challenging for NHSs. So we've just had some information from Birmingham that they're using WhatsApp groups, and some of those social media platforms become very frightening for some of our NHSs to feel comfortable with. So we're going to be looking at some of those. So we're continually trying to have a process, as you can see here, which is about reviewing annually. Where are we? Where can we find out what everybody else is doing? What can we incorporate into our trust? And what are the things that are important that we're not focusing on yet, but need to? And for our final slide, so this is just a final word from our young people, their messages that they really wanted to send today, which is just talk to young people in your services. They will be interested if you find the right way. Lisa and I a few years ago spent many a night in village halls having consultations with families, and one of the things one of the family members said to us once was, you're kind of doing this the wrong way, because you're deciding the time and the place and the agenda, and actually if you offer some topics to us in different ways for us to engage with them, so this point about building the energy, then we will come and we will engage when we've got passion around a particular project in a way that makes sense for us. So we've really rethought this, and one of the things we've noticed with having our youth ambassadors at board is that quite often now in any other business, there's some, you know, our young people will say, this is the thing you need to focus on. So I think one of our huge learning points has been not to set the agenda, but to find the energy, ask for what's important, and we've had a number of topics over the last few years. So we've been focusing on actually what the young people have said, no, this is where you start. And the last couple of points are so important. Share the message at all levels, not especially at the senior level, but not just at the senior level. And look at all the ways of giving children and young people visibility and power. And nothing about me without me, which is IHSCM's quote. And she has a paper around that for those of you who want to find out more about it. So those were the main messages from Lisa and I know both of us just wanted to say a really, really huge thank you. There's been such wonderful discussions. I haven't been able to be here for all of it, unfortunately, but just the last little bit has been so inspiring. And I think there's so much energy and thoughtfulness and care in this group, and it's just, we're so delighted that we've been able to come and spend a little bit of time with you this afternoon. So just a huge thank you from both of us.
Well, weren't they good, folks? There we go. We've got a little bit of time. If anybody would like to ask Ness or Lisa a question, I'm sure they'd be more than happy. Oh, there's some contact details there. Well, you need that, everybody. You're going to be inundated, you two. You wait now. So would anybody like to ask any questions of Ness or Lisa, please? They've not been the most forthcoming group today, you two, in terms of questions. I'll give them another minute, 30 seconds.
That's fine. I was just reading the comments, and obviously we're delighted for you to have a copy of the slides. And Jane, absolutely, we love chatting about youth involvement groups. We've learned lots of lessons the hard way. We've got a lot wrong. So, you know, we really welcome anybody who wants to chat. I say we won't have the magic. We don't have the genie. I want the genie.
Oh, I'll get you one of those. I'll send you one, Ness. I'll send you one. I've actually got I've even got a blue waistcoat here that's supposed to go with it, but I just wasn't brave enough to put that on, to be quite honest. All right, Lise, you've got your hand up, and then we'll come to Jane. Thank you.
Yeah, and I would be really happy to link in with Jane and yourselves, because I think there's a few of us trying to do the same thing. So happy to sort of do that together.
Well, that's the beauty of these things. It's this networking with people that you wouldn't ordinarily necessarily get the opportunity.
And funnily enough, I didn't know you were speaking. Aisha came yesterday to one of our groups to talk about youth forums. So we're in probably a similar place to Jane. We're sold on the idea as a children and families care group. I guess I want your top tips for selling it to the trust and to the board in particular. So this is coming bottom up rather than top down. And we've got a new director of lived experience starting this month, and I think there's someone we'll want to influence about this. But I just wondered if you had any top tips for because I spent most of my time in adult services, and I can think of the times, count the fingers of one hand, we spoke about someone under the age of 60, let alone 16. So how did you get it on the board's agenda, I guess is the question.
Well, I guess we're lucky because we have our separate divisional board. So getting it sort of within children's services within the wider trust was reasonably straightforward. But I think most of the times we've had the opportunities, it's come from us managing to wangle one of our incredibly inspirational young people in front of somebody on the board. So one of our young people actually interviewed the chief executive for the entire trust. And I think he thought this will be a nice little sound bite and will look good in a newsletter. And his feedback was, I was absolutely blown away by this young person. I had not remotely comprehended the depth of understanding that they could have and the nuances that they would be able to spot. And that made me think, gosh, what are we doing for our young people? So we capitalized on that. So each time we've been able to do that, you know, Penna, again, suddenly we became a lot more visible in the trust, and people were like, oh, what are you doing? And by sharing it and by encouraging our young people to be the ones sharing it rather than just us, that really was powerful. So I think find your inspirational young people and facilitate them, support them to speak that directly rather than through a filter, because it's so much more powerful.
I think there were another couple of things we did learn as well. When Leisha and I tried to introduce Facebook a few years ago, we experienced some considerable challenges. What we learned from both of those processes was to listen to the concerns. And we wrote a lot of papers bottoming out how we would keep all of these processes safe. So some of the concerns for young people is, what are they going to be exposed to? What are they going to hear? How are we going to safeguard if we want discussion? You know, are we happy for all of our discussions? So we did a number of things as we wrote. We have a lot of protocols we can share about all of that. We also wrote some infographics about how we were all going to behave in those meetings to keep them safe. And we borrowed from other trusts. So we had a combination, a bit like writing a business case. We have the evidence that other trusts have done this safely. We have the evidence of the benefits of that, and we can give you that because we've now got extensive evidence around that. And then we produced a set of protocols. So I read a Dragon's Den autobiography once, which says cover off all your bases and then go, you know, so there's very little you can say no to here. So once we'd covered off the research, the evidence, how do we keep it safe in your trust? Here are your section of documents. And pilot, the word pilot is brilliant, I find, in these scenarios. So we said we'll pilot it under this guise. We'll keep a really close eye on it. It will stop the minute anything's not happy. And of course, once people get a lived experience of it, then, as you can imagine, Aisha coming to some of our, once people have a lived experience, then it's very difficult for them to not carry on. So there are some other stuff you can do to keep it safe.
Thank you, Ness. Thank you, Lise. I think we've got Jane next. Jane.
Yeah, I'll try and keep it quick. So we're in a slightly different place. So our board are fully bought into the idea, and they've kind of come to us to ask us, right, okay, so what do you need? And we're at that moment of going, well, I don't actually know like what I need. I know we need it, but I don't know what I need. So they're asking us to quantify certain things, how we'll manage certain things. So yeah, actually, when you were talking about all of that, that'd be really, really helpful, because they are so on board with it, because we did a huge consultation with 2,500 children across North Wales. But the how is the step I'm stuck on. So that would be really helpful if I could link in with you, because our geography is just huge. And I don't know whether you've got the same where you are, but yeah, it would be really helpful. Thank you. And really interesting.
There you go. Well, we're honoured to have played a small role in this meeting of minds. It's brilliant. This is what it's all about, you know. Well, look, Ness, Lisa, thank you so much, both of you. What a just a fascinating insight into how you've done it. I mean, I think most importantly of all, you know, lots of people have said it today. Start from the patient or the service receivers and work backwards, and it's amazing how your mind opens up to the possibilities then. So thank you both so much for your presentation. As I say, I suspect you're going to be rather inundated with people requesting this, that, and the other from you. Haven't we had a wonderful afternoon? I mean, I knew that Jade Maloney was good. I didn't know she was sufficiently good to be able to assemble quite such a galaxy of stars. She is the queen of virtual conferencing. Jade Maloney, our operations manager at the Institute of Health and Social Care Management, and I think it's right that we pay tribute to what she's done in terms of assembling you all. I'm blown away by the fact that you care enough to give your time this afternoon and tell other people what's going on. The magic is, of course, the fact this enables people to suddenly make contacts, suddenly develop their networks. And this is all really about just this celebration of best practice and figuring out how we collectively address the thorny issues that we all have around accessing and working with this most challenging of groups, children and young people, but perhaps most rewarding of groups as well. All right, well, look, thank you so much, all of you who've participated in presenting. Thank you, all of those of you who've come along and given your time in the audience and so on. There will be more. There will be more. This is absolutely not the first and last Children and Young People's event that we will do. We will be relaunching our special interest group around children and young people's care, probably after the summer break now, but do please keep a lookout for that, because I think this warrants its own special interest group, as we've just proven this afternoon. But beyond that, thank you so much, everybody, for coming along and enjoying the day. And as again, I do pay tribute to Jade, but Jade, this is true. Sorry. Thanks, everybody. Have a great one. See you on the next one. Bye-bye.